Everyone. It is 12 o'clock, so I just want to welcome everyone again. My name is Ushma Patel. I'm the Director for Special Projects and Educational Programs at IPFCC. You all should have a poll on your screen, so whenever you get the chance, please fill that out so we can get a feel for who's in the room today. And you can also chat your name and organization and where you're dialing in from into the chat. So today's informal conversation is around lessons learned for advancing patient and family-centered care during COVID-19. We are joined by my lovely colleagues today, Bev Johnson, IPFCC President and CEO, as well as Natasha Reed, Registration and Database Manager. You can contact her if you have any issues with Zoom. And we also have Pam Dardis, Vice President for Strategic Initiatives and Operations. She will be our chat monitor today. And we encourage everyone to either speak up and utilize the chat. So let's go ahead and get started. Natasha, can you tell how many people have filled out the poll?
I can. We have a good percentage. So do you want me to go ahead and share results?
Yeah, go ahead and share. All right, wonderful. So it looks like a third of you all are coordinators responsible for implementing PFCC initiatives. Another third, patient resident or family advisors, which is great. We also have folks from patient experience and patient relations, as well as a few administrative and clinical leaders, physicians, nurses, and quality improvement staff. If your role was not listed, feel free to chat it in, and we'd love to see where you're from and what your role is. Thanks a lot for being here. We can go to the next slide, actually. So again, if you haven't joined us before, welcome for the first time. We're so happy to see you. The goal for today's conversation is truly to learn from each other, and the purpose of the conversation is shared learning. So we hope you all will join the conversation and chat. Feel free to speak up. You can also use the raise the hand feature. And again, all resources and the recording from today's conversation will be loaded onto PFCC.Connect later this week. Next slide. So the last time we met together in January, it was pretty cold and in the middle of winter. Unfortunately, today here in North Carolina, it's still cold, but now that we're approaching April, we welcome spring and all the new growth and opportunities that are coming our way. I hope you feel the same as well. And we hope wherever you are, spring brings sunshine, new beginnings, and time to enjoy the outdoors with your family and your loved ones. Next slide. So before we get started with today's discussion, I wanted to remind you of a new resource that is up on our website. So in January, Bev and Deborah Dawkin, our other colleague, facilitated a wonderful informal conversation on best practices to preserve the essence of family presence during a pandemic. And from that conversation and information gathered from other hospitals and organizations, we developed this new resource, Emerging Best Practices for Preserving the Essence of Family Presence During a Pandemic. There are a ton of examples in this resource that show true commitment to family presence, a lot of creative and safe strategies to support families as essential care partners. So I know Pam's going to put the resource link into the chat, but we want to thank all of you, our wonderful PFCC.Connect community, for contributing to this resource. We encourage you to share it with your colleagues and in your network. And it's also an evolving document. So if you have other ideas and practices to share, feel free to email Bev or myself, or even just our Institute email address, which again, Pam will put into the chat. Next slide. I wanted to point just a few examples from this emerging best practices document. So the pamphlet at the top with the flowers actually describes the role of designated support persons and outlines factors that increase and lower COVID risk. This was developed by the Alberta Health Services COVID-19 Family Presence and Visitation Task Force. So it's a great resource. Saskatchewan Health Authority, right there on the bottom, has shared several family presence tools and resources. Patient family partners serve on a lot of their committees, and they've all been involved in the co-design of these resources, which is just fantastic. And we'll put put the link into the chat for that as well. And finally, that image on the right was submitted by Northwell Health in New York. They've implemented many initiatives to appreciate and support their healthcare staff. This image is actually from a pop-up gratitude station where executive leaders participate and give a well-being gift box to their employees. Other events included a drive-in family movie night, some concerts, and an invitation to have 6 free chef-prepared meals delivered directly to their employees' homes. So it's just been wonderful seeing all of the strategies that different hospitals and health systems have been taking to incorporate family presence during the pandemic. So we want to see this document grow. So please, if you have other ideas, definitely share with us. Next slide. So I know we've had, several informal conversations in the past 2 years where we've talked about all the challenges that healthcare has faced with COVID-19. The idea around today's call is, what if we shift our thinking and perhaps discuss COVID-19 as what we call a positive disruptor. So as you can see on the slide here, a positive disruptor is someone or something that challenges current organizational trends and habits and strives to find positive alternatives. And a positive disruptor can seek to uproot, replant, and grow the way we think, behave, conduct business, learn, understand, and live our daily lives. So with that in mind, we're going to start off with an interactive Mentimeter exercise. You can go to the next slide. So for all of you, either on your laptop or on your phone, you can go to menti.com and type in the code. And I'd like you to think about in just a few words, how was the COVID-19 pandemic a positive disruptor for you, your family, or your organization? You can submit multiple entries. I think it's up to 10 per device. And, feel free to think outside the box and reflect on how it's impacted you professionally, but also personally. And once we get a couple of submissions, I'm going to go ahead and share that word cloud and see what we all have come up with today. Okay, can everyone see my screen okay? Right, oh my goodness, it's moving so quickly, but I see a lot of different positive ways that COVID-19 has impacted you and your family. This is wonderful. A lot of work from home, work-life balance. I think we can all relate to that. It's so fun to see word cloud move, and it looks like a lot of folks are saying working from home, slowing down, rethinking priorities, more time with family. I see somebody put in enjoying silence. This is just wonderful. All right. So feel free to keep, submitting your responses, but a lot of different ideas have been submitted. This is just great. There's a lot of mental health, innovation, expanded hobbies, flexibility. I love this. Pets in Zoom meetings. Maybe you're here with your pet. Reflecting, slowing down. This is just wonderful. Great. So we can actually go to the next slide. So kind of using this as your frame of reference for today's conversation, we want to go ahead and get started with our discussion questions, which Bev is going to lead the first set of questions.
Thanks, Ushma. And that word cloud is really thought-provoking and I think sets a nice foundation for our discussion today. A couple of words that jumped out at me were togetherness and family time. And I'm wondering the perspective of that in terms of those of us working from home, and that gave us some of that flexibility. But what about those who were experiencing healthcare during that time? Would they have put togetherness and family time? I think another very relevant for today's discussion is rethinking priorities. And I'm hoping that all of us on the call today and leaders out there in healthcare are really thinking now about rethinking priorities. And perhaps this is a time that we can really advance transformational change. So let's look at some of these questions. And this is very informal conversation. We don't have to take any in order. I'll just sort of highlight, are there positive ways that your organization has responded to COVID that would really help us advance the practice of patient and family-centered care? Are there new ways that you've seen that you're partnering with PFAs and PFACs in all kinds of settings in acute care and long-term care? And are there new strategies that you have put in place that help connect families near and far with a loved one who's having a healthcare experience? So any of those, anybody want to comment, raise your hand? You can turn, I think if you can raise your hand like this or on the feature at the bottom of your screen called reactions. But I can see some of you. Oh, I see Teresa at the top of my screen, and I see Kathy Hansen. Teresa, can you unmute yourself and share a thought with us?
Sure.
Tell us where you're from.
I am from Dayton, Ohio, from Dayton Children's. I'm a family partnership coordinator. And I know with COVID, it forced us all of us to fast track into the virtual world. And in doing so, it really opened up more of an opportunity for advisors who have younger children or who have transportation problems to be able to become involved.
I think that's wonderful to share that. I think that's so true. We were seeing that all across North America. we've often had trouble with families with very young children to participate, but now that can happen. And just the time that people save. So thank you for sharing that. Kathy from Miami, I think.
Hi,
Great
Bev.
to see
Thank
you.
you. Nice to see you too. So we did two things here at UMiami that so far have been really successful. On the COVID side, in terms of reaching out to families, we established a program to have a bilingual individual call the families of everyone that was hospitalized on the COVID unit. This was really helpful because we called every single day and we developed a structure around that, but also helpful in that almost all of our patients, not all, but many of them are Hispanic, and we learned a lot about ways to improve our cultural sensitivity from a hospital perspective. And just one example was that the university did not support using WhatsApp, for example, but most of the families that we interacted with used WhatsApp. So in order to do FaceTime, that was the tool that was necessary, and our IT department didn't necessarily understand that. So I really look at, it's a small thing, but was very successful. And it was particularly successful for us to do this around end of life, when we had to learn how to interact with families from a very sensitive perspective. And very quickly, the other thing that we did is working in conjunction with Press-Ganey, our survey tool, we developed a very robust e-advisor program. We grew it from nothing to over 2,500 volunteers. And UMiami is spread in multiple locations, and we have been able to recruit advisors, get advisor input from people that couldn't be in person, and use the survey tool in particular, doing that for telehealth, because telehealth became a huge tool that we could use during that time. So I could go on and on, but I'm not going to.
Well, Kathy, come back again with more ideas. These are wonderful ideas. I love the idea of that proactive call to families with a bilingual interpreter to work with them. I think in the future, to think about that, if families aren't there when they can be, that really to reach out to involve them reinforces their importance.
It was eye-opening to us how much need there was, and how unwittingly insensitive we were being in terms of facilitating communication for families.
Yeah. I think a number of folks, I know I heard from the Kingston General people about a similar observation about proactively involving families and using technology. Either Angela or Anne, you want to comment on how you all were doing that?
Sure, I'll start, and then Anne, maybe you could jump in. So I'll start with, and I just love this, what a great conversation, and I'm so happy to be here. And we did see that, as we looked at the priority being that family presence be part of care, we did have in-person family presence for specific vulnerable groups all the way through the pandemic, but there were still people that we wanted to ensure had presence even when they couldn't be there in person for various reasons. And so there was what we called the Staying Connected program, which our advisors commented that, so we were engaged with our patient advisors in the development of this, and what they said from the beginning was, we need to be able to create those connections to the care teams for the family members and to their loved ones with the family members. And so they flagged, though, that not everybody has an iPhone, not everybody knows how to use technology, not everybody is comfortable doing that. And so we started with a project that was facilitated specifically by Spiritual Health initially to facilitate those conversations, and an iPad would be brought to the room and they'd have that. But there was such a great uptake on the program, that it continued to evolve based on the feedback we were getting from patients and families. And so eventually we went from, a few spiritual health care providers providing that to actually hiring a moderator who would triage between the patients that could maybe just have a volunteer facilitate that visit versus having to have a clinical person facilitate that we would and that we would continue to ensure that the family could be proactive in identifying when they would like to connect and how and so forth. And so over the course of the last couple of years, we have continued to sort of add to that program and change that program to adapt to the needs of the patients and families. And we're hoping, based on the feedback, which was incredibly positive, that it's something that will continue into the future, because what we were hearing was from families who are in different parts of the world, different parts of the country, that would not have been able to be present with their loved one in any other way. And we just didn't have that technology in place before COVID. And it just very quickly got sort of put up, and the iPads, people who weren't using iPads in other parts of the hospital started donating their iPads into the program. And we ensured that we monitored it, got feedback and evaluated it throughout. And so we continue to see the value of it. And we're hoping that we're going to see it continue into the future after COVID as well. Anne, do you want to jump in?
Well, I'd like to pick up on the word proactive that Bev mentioned. And one thing I will share is that our PFAC at the hospital heard about the pandemic, the looming changes that people assumed were coming in February. But before the pandemic was called, specifically March 12th, we had members of PFAC meet with the leadership at their request to look at how to shape the family presence policy. And so we met to do that in advance of the pandemic, and we continued in a small group throughout the following 2 years, and we're continuing to look at that policy on a regular basis through virtual meetings, through communication and email, and we've had input in the co-creation of our family presence policy throughout, and in how that's communicated to the public. So I think that's a really positive way that we've been able to say patient experience advisors are involved at the front line in helping to ensure the hospital listens to patient, family, caregiver voices while maintaining safety for all.
So, Anne, I just want to make sure I heard you correctly. That initial meeting, really right at the beginning and almost before it was officially declared a pandemic, the PFAC reached out to senior leaders. Is that what you were saying?
Actually, it was the other way around. The senior leader reached to PFAC and said, we need your help, and we want to start working before things close down, knowing that that seemed to be what was happening. And we met offsite at a coffee shop, and we named ourselves the Balzacs group rather than the COVID group, because that's where we met initially. And it really created a bond in this group that we were in this together, leadership and patient advisors, and we've continued that bond. And I think the relationship and the trust that existed prior to the pandemic was really strengthened in this process and continues today.
That's wonderful. So I really think that's an important lesson for all of us to think about in terms of the role of leaders. It could go either way, but the fact that that early meeting happened to recognize that having an ongoing communication like that is so key. I think, again, I have such respect for the way the Canadians handled so much of the pandemic, but I think we did not see that always, that senior leaders were doing that outreach. So I think a real takeaway from that is that we need to continue that. Are there others that I saw someone in the chat talk about being able to quickly move to PFAC meetings via Zoom, that has been a great strength for, I think, 3-4 years ago, there's been discussion about virtual meetings, and we had no idea how effective they could be. And so it's exciting to see that it's making it possible for more people to participate and that people actually participate. Other thoughts to share about?
Deb, it looks like Beth Moon has her hand raised. Yep.
Oh,
Yes,
I so apologize. I, for some reason, cannot raise my hand on Zoom. And I tried to figure it out yesterday and still not working. So I apologize.
Anyway, that's just great.
I'm Beth Moon. I'm with Cincinnati Children's. And I kind of want to continue on with this last topic, the positive ways. You know, when COVID hit, all of a sudden, feedback was being requested from our PFAC fast and furious. We couldn't keep up with requests. And I found early on that I was going to have to form what I called a COVID family response team. And it was a team of 8. And the expectation was that the feedback would be requested by email and we needed it as soon as possible. There were times when we were reached out that we needed something within 2 hours. Before the pandemic, I would have said, "Are you kidding? No way. I'm not gonna inflict that on families." But I knew that, and they understood that we needed this information really quickly. And so I picked these advisors. They were, of course, on my PFAC, and I knew I could count on them. And they hung with us through the pandemic. And then we also used the PFAC because we missed a couple weeks and then we had PFAC meetings, but I couldn't wait for those monthly meetings. So I had to have that small group. And we, you know, they gave feedback on masking, screening, messaging. We helped inform nurses, wrote scripts for them so that when they walked into the room for care, that they could say to the families, "Please put on your mask." Just some things that we helped, but I couldn't have done it without that team. And, you know, they were grateful too. They said, "Beth, we're feeling normal. We feel like it's normal to be doing this, even though we're not in person in a very abnormal time right now." And I think how it advanced the voice of the parents is our organization saw the impact of those voices, and the families felt the impact and the value because they saw what the feedback they gave right away, that they saw the next day there would be messaging. Wow, we contributed to this. So it was a win-win for both the organization and the patients and families.
That's terrific, Beth. And I think that's a piece of what you're saying, that we need to make sure that leadership understands that PFACs can turn and be quickly responsive. During the pandemic, you had to do things so quickly, and to realize that, you know, the coffee shop group, the Balzac group could mobilize quickly, that you all could in Cincinnati, that was so important. And Laura, did you have something to add and our new direction to take us in?
Yes, I just wanted to make a comment about what our Family Advisory Council did throughout the COVID pandemic, and it is also still ongoing. I'm Laura Rohde. I'm from Nationwide Children's Hospital. So hello to my Ohio friends, Teresa and Beth. Yes, I just wanted to say one thing that we started to do were what we ended up calling COVID check-ins. So with our roster of parents on our Family Advisory Council, we started kind of keeping an eye on the ones whose attendance were dropping lower than normal. We had some members who were very highly engaged and participated, who would then go to, you know, a couple, 2-3 meetings that they were missing, because we switched to completely virtual, as everyone mentioned, throughout the pandemic. We actually found that worked well. And then when we started seeing people drop off, we got concerned. So what we started were COVID check-ins, and not from the faculty standpoint or the administrative standpoint. We had our parent chairs or just parent representatives call those members whose attendance was declining and had them check in purely as a COVID check-in, not punitive, not a "where are you? We see that you've been missing meetings." Just "how are you? What's been going on in your life? Is there anything that we can help you with?" And then also, you know, then kind of start talking about the meetings and finding out if this was still a time that worked well for them, finding out their accessibility, if they had smartphones that they could use or tablets they could use. We found also that a lot of our family members had canceled their nursing hours during COVID. So not only were they full-time working moms and dads and full-time parents, but they were also then full-time nurses on top of it. So we, there wasn't a lot that we could do, but we decided to then start recording the meetings for families who couldn't attend or didn't find value in just reading minutes. We started recording the meetings and having those available. So little COVID check-ins is what we started to do.
That's terrific. I know another place at Dartmouth in newborn intensive care, for their advisors, they called it office hours. And it was really what you're describing, which is so important. And again, I think it's another idea that going forward, it was that emotional check-in. We certainly with COVID, there was extreme social isolation, but you were reaching out and again, proactive support and connection for people. That's terrific. And Beth is reinforcing that message, that it's saying the sense of the power of community and that connection in community.
Yes,
one of the questions coming to you, Laura, from Barbara Lewis is, do members listen to the recordings? Have you found that useful?
That's a great question. We have only had the recordings requested because they are, the recordings, when you save them, they're such a large volume or large content. We haven't put them out on something like social media or anything like that for everyone to see. But what we did do is let people know if they wanted to listen to them to reach out to us, and we would send them to the individuals who were interested. And we had one person who consistently was interested in them. But a great question is, did she listen to the recordings? I hope so. I didn't really follow up to say like, hey, I sent it to you. What do you think? Or because that is definitely more time consuming than reading the minutes to actually sit through the meeting. So we really only had one or two parents utilize that. And now I have a follow-up question I will start asking if they do ask for the recordings, what did they think about them? Or, did you have any trouble reading them or watching them?
Great. Allison, did you have something else to share?
Hi there. My name is Allison Krause. I'm the patient experience manager at Johns Hopkins Community Physicians. We have a lot of primary care offices, pediatric, family practice, internal medicine. And one of the things that we had a lot of success in recruitment for PFACs specifically is having what I'll call agenda focused items that are like ask the experts. And then we would have someone from our vaccine area provide information for parents, specifically when vaccines were still ramping up for pediatric age groups and things like that. So making sure that people had access to ask questions at different stages of vaccine development to be able to express their fears and be able to be provided the most current information as a way for a recruitment strategy to get them in and then be able to continue our normal, I'll say PFAC strategy of trying to find meaningful and actionable items for the people we care for.
That's terrific. That sort of builds on an idea I'd seen in the Netherlands, where their current PFAC members wanted the same idea, talk to the experts about their children with special health needs, but they broadly broadcasted that to the community. But the thought that you actually used it as follow-up for recruitment for advisors, that's terrific. Teresa, did you have another idea to share?
I just wanted to follow up from Laura's comment about the recordings. One of the things that I did with our advisory councils and our family action collaborative teams was each one has their own Microsoft Teams channel. And so through the Microsoft Teams channel, I do the recording, but you can also do a transcript along with that recording. And I know that being able to house that recording directly on the Teams channel with all of the members having access to it. I do have several members when they're not able to attend. You can see when they've viewed it and they always comment. It's been very successful for my councils.
That's great. We use Zoom more frequently, and we use Otter to generate a first draft of the text to work with and then to edit, but it certainly has saved. We're getting more detail to work with. Thanks for sharing that. And Heather had some comments. Do you want to discuss this further, Heather, about some of the wonderful work in Saskatchewan in terms of partnerships with patients and family advisors? You all had such a range that were advising the provincial government at so many different levels. Oh, there you are.
Hi, thanks, Bev. Yeah, and it was interesting. I think, like most places, we were in shock in the first couple of weeks of COVID, but it was quickly, because we've been at this 15 plus years, patients and families are like, no, we need to be part of these conversations. So it was just, how do we do this in a new way? So it was more on creating these expert advisories, really looking at what can family presence look like, especially with more restriction and things like that, but also ensuring that, you know, patients and patients were not alone. So it was interesting that way. And also these rapid. So when we needed quick answers, our patients and families came to the table and they said, well, we can do quick answers as well, and happy to do that. So, you know, even our provincial, I co-chaired our provincial advisory leadership council, and we were trying to help support and do things that we can. So I guess now we'll be looking at system recovery and how do we go back to that new norm of combining, but we have a full, you know, so many engaged patients and families who just want to help, and it's so exciting to see that.
That's wonderful. You all have truly made a difference. And, you know, I wish, and whether it's a page we can take out of the Canadian playbook, I felt like you all were really structured in a way to give advice to the province about policy. And in our country, some of that statewide policy was coming from the governor. And I'm not sure that you all had a provincial structure to begin with. And I think that's something for us to think about in the United States. Our PFACs are organizational based, but how could we better advise the governor in a future pandemic?
And I won't say it's not challenging, it's still challenging, but it did help having that patient first review happen, 15 years ago, where it was mandated from the government that we really shift our thinking from system-centered to a patient family-centered way. And of course, it's changed along our journey. But I think we will get there where we get back to those conversations. So thanks, Beth.
Other thoughts that folks want to share? Is there another hand up? We can move to a different set of slides. I don't want to leave anyone out.
Yep, that's actually what I was thinking, Bev. Maybe we can move to the next topic. There is some back and forth with Teresa, I think, regarding access to the recordings and the files. It looks like advisors don't need an organizational email. So that's great. You're, reducing that or removing a roadblock to get access to that. So that's wonderful. Teresa, did you want to expand on that at all, or?
No, I just know that I did work very closely with IT to work out any of the kinks. And then I was able to develop a tip sheet that I send to all of the new advisors on how to access and download the Microsoft Teams as an external user, because there's a difference on how you do it as an internal versus an external.
Great. If you could share that, that would be wonderful.
I'd be more than happy to.
Wonderful. So the next question on the slide here for all of you to consider, and I think we've touched on this a little bit, but how has COVID-19 and its impact challenged your organization to adapt care delivery? So, for example, in telehealth and virtual visits, how has it challenged your organization to support staff more and improve overall morale, and then engage leadership? So I see, Kathy, you have your hand up again, if you'd like to speak up.
Yes, thank you. Trying to make everything work. One of the groups that I'm involved in is called Home Run. It's out of UCSF, and it's a consortium of hospitals primarily focused in the United States. I'm not sure if we're present in Canada as well. But one of the first things that Home Run did was do an analysis of patient visitor restrictions. And we did that by looking at across, I think, 88 hospitals at the time, looking at the hospital websites and how information was presented regarding visitation restrictions. And it was really enlightening. I did some of the preliminary work for that. And you can read the results. It's been published through that Home Run Consortium. And I don't have the link right now, but I will send it to you for anybody who's interested. But what we saw was that hospitals primarily had difficulty trying to balance marketing needs, if you will. We're communicating to other hospitals and we're competing versus how to present things that would be patient friendly. And would be easy for families to traverse. So we learned a lot from that at UMiami in terms of how to communicate with families. So that was, I'm going to say that was a positive from learning about COVID. It's how do we communicate via our websites to patients and families? And is there a way that we can share how we're doing that and what our best practices?
Great, thank you for sharing. It'd be wonderful to see and read more of the report results from that. Claire, I see that you have your hand raised. Would you like to share or?
Hi, yes, I'm Claire. I'm one of the pediatric nurses at Children's Memorial Hermann in Houston. And I feel very proud the fact that we started our Pediatric Parent Advisory Council at the beginning of COVID, the pandemic, and obviously it all had to be Zoom. We had one parent who decided to opt out because couldn't manage to do that. And then other parents who've been willing to join our team. And we've had great support from leadership. We've had pediatric surgeons who've attended our meetings, child life therapists, social workers. We just haven't met any of the parents in person as a group, but I just think, we've learned so much, and we're now offering support to other teams that are starting up as well. So just, feel very proud of our group, our parents and our members of staff who've willingly joined.
Great, thank you. Emily?
Ushma, I'm sorry, this is Pam. Barbara Lewis has to leave soon, but has a question. So I wanted to make sure she had an opportunity.
Thank you, Pam. I missed that. Barbara, would you like to speak up?
Thank you so much. I really appreciate it. I didn't say what happened positively about myself, but at the beginning of the pandemic, I applied to an in-person PhD program and was accepted. And of course, everything has been online for the last 2 years, which is great because I don't live in the city where it's being taught. So that's been very positive for me. And to be in a public health PhD program during a pandemic is just phenomenal. It's unbelievable. My question is that I have been talking to a patient experience officer recently, and she's told me that the hospital is interested in going back and letting visitors in, but the nurses are against it, which was sort of shocking to me. And I was wondering if anybody else had faced this situation and how they handled it.
While others, I'll just comment quickly, Barbara, while others are thinking of a response. I would quickly look at the two newest publications from IPFCC.
I sent them those publications, actually.
Oh, great.
Because they had
think,
great information about it. And I said, this should be shared with the nurses.
And I think and both have very extensive bibliographies and talk about what many nurses are saying, the value of having families present. I remember our Canadian colleagues, Anne and Angela, talking about we appreciate so much more what families bring, but I think it's the support, recognizing that families are not, quote, visitors, but essential care partners, and proactively building support for them to behave in that way and to work with us in that way, I think is really important. But others may have some solutions to this. So Angela may have an idea right now. Ushma, in response to that?
Thanks, Bev.
Mm-hmm.
First of all, I don't have a solution, but I will share that I think that that's a really common consideration. And I think it comes from a place of fear. And it really takes me back to like 10, 11 years ago when we first introduced family presence. And there were all kinds of reasons that you couldn't have, why wouldn't you have families present, and like overnight and security and blah, 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 blah. And we always came back to, if it's the right thing to do, you figure it out. And so I think that's the space we're in right now with some of the fears, because in fairness, there's a few things that have been raised in our considerations around family presence. We're hearing from infection prevention and control about you have to have physical distancing, and everybody has to be wearing a mask, and everybody needs to be vaccinated. And so we get all these messages, and then we turn around and say, we're going to let family members in who have not been vaccinated. You're going to have to police them and make sure they're wearing a mask. They may not always be polite and pleasant. They may not do the education that we want them to do. And so nurses react to those things, right? And so the reality of what are we facing on the floors in real time is really important when we say, this is not really negotiable. We are going to have family presence, but we need to understand and accommodate for the things that don't go right. And so we just need to sort of work on that. So what we've been working on is we have sort of a combination hybrid situation going on, and we're about to change it again. It's changed regularly throughout the last 2 years, but we did institute sort of a care partner program. And what we did was we made sure that we had frontline involved in the creation of that work as far as the education and how we were going to have family presence in certain areas of the hospital that were struggling with it. But then we also had an opportunity to hear back from them and say, okay, what's not going right? Because a lot of cases, the things people are afraid of don't happen. And so it's really about getting past that initial, I'm really afraid, we don't have time to manage this. Like in our case right now, huge short staff situation because of an uptick in COVID in the community. We have a lot of staff out. So we are understaffed. People don't have time to police family presence. And we want them to be caring for patients, not policing families. So we're asking families to be partners, actually be partners, and listen to why we're asking them to do certain things. But I think engaging the staff in those conversations, the last meeting I was on was around an outpatient, bringing people in from outpatients. We've had huge concerns about space. We just don't have space. But when you go into it from, we're doing this, how do we make it work? By the end of the conversation, you find those ways, but you acknowledge that, okay, when there are challenges, we'll address those, but those are going to be the exceptions, not the rule. we're going to design not for the exceptions, but for the rule.
Thank you. That's very helpful.
Emily, did you want to share something?
Hi, everyone. My name's Emily Lee. I'm a coworker of Beth Moon's at Cincinnati Children's, and I was raising my hand for her so that she could speak. So Beth, take it away, since it's not working.
Thank you so much, Emily. I just kind of wanted to address COVID and its impact. So I think the biggest impact it had on our organization and the PFAC is just that need for collaboration, that you just can't do it all yourself. So what I found myself doing was not only utilizing the main board, but reaching out to our 8 department-led councils to get their feedback. The more the merrier. And then also at the time, Cincinnati is part of a pediatric experience collaborative, and we had a 15 hospital focus group all regarding telemedicine. And so we got great feedback to give to our organizations on what we felt that families were going to need to make this successful and very family-centered. So the key to us was just the collaboration, and I think that was a huge impact.
Can I ask Beth a question, or anyone else on the call for telehealth? Is anyone using patient and family advisors to help teach clinicians how to build trust in a telehealth conversation, how to interact with an individual or family in a telehealth meeting? I don't see that. I see them helping in terms of developing the system and maybe the check-in, but not building the skills for communication via telehealth. Just chat it in if you have, or send me an email. Thanks. Sorry, Ushma.
No, that's okay. Julie, would you like to share something?
Hello, my name is Julie Arias, and unlike many of you, I don't work in a hospital, but I work for Ronald McDonald House Charities. And I just kind of wanted to echo, not this past comment, but the comment before about having families in clinical settings and in the Ronald McDonald House and in the Ronald McDonald Family Room, which I oversee 2 of those in 2 of our local hospitals. And one kind of thought or idea that we haven't really talked about is the understanding that families have that they have so much skin in the game. So they know every day when they're going to go visit their child, or if they're waking up and they've got a new maybe tickle in their throat, they're hyper aware that, hey, if this is COVID, this means X, Y, and Z for not just the patient, but the whole family. And, you know, I encouraged my colleagues around the Ronald McDonald House system around the country to go ahead and open the family rooms back up and go ahead and go forward with having families present, because people know, like you said, not 100%, but I feel like 95% or more people are behaving correctly. They're making good choices. They're staying clean. They're staying separate, and they want what's best for themselves and their families and their children as well. So, you know, I really applaud what you all are doing in the hospital settings.
Great. Let's actually go to the next slide. I can't believe we're already almost at time. So just wanted to make sure we get to the last couple of discussion questions. So if anyone wants to chime in here, but what new initiatives do you foresee being sustained beyond the pandemic? So it seems like a lot of new initiatives have been implemented, and what's here to stay past the pandemic? And what positive changes have you made in your own work that you will continue to implement? So feel free to put it in the chat, or we could probably take 1 or 2 comments verbally if someone wants to raise their hand or unmute. A lot of great things in the chat as well. Okay, well, let's go ahead and move on. hopefully you all can continue the discussion. So actually building on what we talked about today, there is an interesting article in JAMA Internal Medicine that actually touches on the importance of connecting with patients and families. That's actually just one of the lessons learned that the authors discuss. For me, I think it'd be really intriguing to see, a similar article that focuses on primarily patient and family-centered care and see how this could be reframed. So I know Pam's going to put that article in the chat. Kathy, you had your hand raised again. Did you want to speak up?
Yes, very quickly. Coming out soon in the Journal of Hospital Medicine is a special article that is focused on building trust with families in healthcare, especially during this time. It's not, the date of that publication isn't finalized yet, but the entire journal is going to be focused on that. And the home run PFAC that I'm on, which is national, there are 10 of us who sit on that over the 88 hospitals, wrote the opinion piece that goes at the front of that. And it is all about how to build that trust with patients and families. So perfect.
Yes. We will look out for that. And once you have the article link, and feel free to share it with us, and we'd love to put it in our newsletter.
Will do. I'll make sure to send that. Thank you.
Thank you. All right, you can go to the next slide, Natasha. So just as a reminder, we will be posting the recording of today's conversation, the chat and the slides, as well as any other tools or resources that you all want to send me. We'll make sure that all of that is included on the website so that you can refer back to it. We encourage you to also, start your own conversation on the forum, send in any links or examples. And then we also would love it if you could fill out our evaluation from today's conversation. The link is here. Pam's going to put it in the chat, but truly this is your platform and your forum for discussing, and we want to make sure that it fulfills your needs. So please, if you could take just 2 minutes to fill out the survey, and that would be so helpful and for us, and we'd be grateful so that we can figure out, what are the next couple of months of conversations going to look like. So that is all we have for today. Bev, would you like to say anything before we leave?
Just please continue to share your great ideas and experience. So helpful, and we will try to spread it to the field as well. But thank you for all this thoughtful conversation today.
Thank you so much, everyone. Take care.